The fact that we have to talk about two very deadly, very challenging, poorly understood viruses for which we don't have existing vaccines. It typically is something that people get from rodents, and the only reason why we're seeing it spread now between people is because these people are on a cruise ship. Fortunately, we have been able to contain the spread of Andes virus. I don't expect to see many more cases, but it could have been so much worse.
But how do we communicate risk without creating panic?
You can ask people to do things like stay home, but the mechanism for that is how you communicate. Diseases love to exploit social vulnerabilities. They are very often propagated in populations that have the most amount of vulnerabilities and the least amount of resources.
Just to talk a little bit about the Ebola Bundibugyo outbreak. Good morning, everyone. Welcome back to another episode of Global Health Uncensored. Today, we are talking about a world that says it learned lessons from COVID-19 while the next warning signs are already here. Recently, a cruise ship outbreak of Andes virus, Hantavirus, became an international surveillance and quarantine problem. At the same time, the Ebola outbreak caused by the Bundibugyo virus in the Democratic Republic of Congo and Uganda has been declared a public health emergency of international concern by the WHO. WHO has also reported more than 1,000 suspected cases and 200 suspected deaths. Dr. Tedros has warned that because detection was delayed, responders are now playing catch up, and the epidemic is currently outpacing response efforts. So today's question is uncomfortable but necessary. Are we actually prepared for emerging infections? Are we still reaching and reacting too late, responding too slowly, and hoping fragile systems hold? To help us answer these questions, I'm honored to be joined by Professor Jennifer Nuzzo, who is the director of the Pandemic Center and Professor of Epidemiology at Brown University School of Public Health. Professor Nuzzo is a nationally and globally recognized leader in global health security, public health preparedness and response, health system resilience. Her work includes co-leading the Global Health Security Index, advising governments and organizations on pandemic preparedness, and helping shape how countries measure and improve readiness for infectious disease threats. Professor Nuzzo, welcome back to Global Health Uncensored.
Thanks for having me. It's good to see you.
Good to see you again. So, when you look at the current hantavirus cluster and the Ebola outbreak together, what do they really reveal about the state of pandemic preparedness today? Are we stronger than we were after COVID-19, or we are still dangerously reactive?
Yeah, so we have to learn from every single event that happens and try to gain from it all the insights we can to understand what our vulnerabilities are, to try to understand our strengths, because strengths need to be maintained in order to remain strengths. But also there is other lessons. And I think for me, when I look at the outbreak of hantavirus aboard the cruise ship and the ongoing outbreak of Bundibugyo virus in DRC, I think that first lesson that jumps out is that if there were any hope that after COVID-19 we would enjoy a period of quiet, those hopes continued to be dashed over and over and over again. The fact that we have to talk about two very deadly, very challenging, poorly understood viruses for which we don't have existing vaccines or treatments and are now asking are our systems up to the task of trying to stop it regardless. I think all of that tells us how challenging it is going to be to continue to prepare for and get ready for disease emergencies, including pandemics. And on the overarching question of are we prepared, I didn't need the hantavirus or the Bundibugyo outbreak to point to vulnerabilities because I have been, at least from where the United States is concerned, but also other countries, looking with horror at the growing, spiraling outbreaks of measles that are happening. And that has already told me everything I need to know, which is that we are simply unprepared and that there are critical gaps in our readiness. We shouldn't be having outbreaks of measles, and the fact that we are tells us that we are not doing what it takes to respond to even worse scenarios.
Yeah. And I think the hantavirus cluster shows how, for example, a rare pathogen can quickly become an international coordination problem. But what should public health systems be doing in this moment? Were there anything that we weren't doing initially that you think now is the best time to actually start doing those things?
Yeah, so the hantavirus, and specifically we're talking about the Andes virus, which is the
Hmm.
species of hantavirus that is responsible for this outbreak, I think has really highlighted some key vulnerabilities. First of all, when the outbreak was first recognized, there were many who saw it as, well, we know about this virus. It typically is something that people get from rodents. It very rarely, people were saying, spreads between people. And the only reason why we're seeing it spread now between people is because these people are on a cruise ship. And we know that cruise ships are particularly a common source of infection. Outbreaks commonly occur on cruise ships. And, I think that actually was not the right story to tell regarding this outbreak, because in many respects, I think we got lucky that this outbreak happened on a cruise ship, because the first case likely contracted the virus not on the ship, but then was on the ship and was contained for an extended period of time, surrounded by people, sure, but surrounded by people whose identities were known and their whereabouts could be spoken for over the period of time in which they were exposed. I think about, what if that first case, instead of going on a cruise ship for several weeks, decided to present to an emergency room or a
Hmm.
urgent care center, and how many people might have been exposed, and how hard it
Yeah.
would be to try to find them and to try to figure out where they were during the period of time in which they may have been exposed to the virus and potentially incubating the virus if they were later found to be infected. So, really, really challenging set of circumstances. And fortunately, we have been able to contain, I think, the spread of Andes
Yes.
virus. I don't expect to see many more cases, but it could have been so much worse. And one key, I think, shortcoming was that there was a tendency to do exactly what public health authorities did wrong in the early days of COVID, which was to undersell the threat potential of the virus, to try to reassure people by stressing details that were probably not well supported by the data. So I'll speak for mostly the US health authorities, who assured the American public that human to human transmission was rare, and that when human to human transmission did occur, it was from people who were very sick and after extended periods of time. And when you look back, even at the very limited data that we have on this virus, that's not really the case. And so that tendency to be overconfident, probably because they wanted to tamp down worries about the virus, that's really a terrible mistake that we have seemed to keep repeating.
Yeah.
Another big problem, I think, the US was very late to acknowledge that the outbreak was happening, to talk about what it meant for Americans, even though, the outbreak was probably never a real huge risk for the American public. But Americans were involved. And so, therefore, our national health authorities have, I think, a responsibility to speak out about it, because when they don't, in the absence of information, all sorts of rumors and lies will flourish. And ultimately, that's what happened. And that's probably why health authorities then kind of overcorrected by trying to tamp down worries, by doing so by relying on really kind of concerning, not well supported assertions.
Yeah. And I think one important thing you raised is the communication aspect of this. I know sometimes we try to beat down the communication just so to reduce the uncertainty and the panic. But how do we communicate risk without creating the panic, and also making sure that we are providing the real situation on the ground so that people will not be overconfident about the situation
Mhm.
while also remaining calm?
So I think we need in public health to fully accept and embrace that communication is the most important public health intervention we have. It's not a thing you do in addition to the public health interventions. More often than not, it is the intervention. And when we're talking about diseases for which we don't have vaccines or treatments, really, public health communication is the only intervention you have. You can ask people to do things like stay home, but the mechanism for that is how you communicate. So we have to elevate the communications to the level of intervention that it actually is, and rather than view it as an afterthought. In terms of how you communicate when there's uncertainty, it's exactly that. It's by conveying the uncertainty and saying, here is what we know, here's what we still don't know, here's what we are recommending based on the knowledge that we have, and here's what we are doing to figure out answers to the holes in our knowledge. And if we get new information to suggest otherwise, we will update you as soon as we know and tell you to do something differently. In the case of the Hantavirus, I think it was quite clear from the beginning that this was probably not something that was going to be a huge risk to the general public. And so people would ask me, well, what should I do differently? And I will say, well, I personally am not doing anything differently. I don't feel a personal sense of risk around this virus. Obviously, if we start to see the virus do new things, then we might, change that calculation. But as this moment, we don't have observations of concerns. When you can say something like that will, of course, be tied to the facts of the case. I think in the case of COVID, we didn't know, but we couldn't rule it out. And so, you obviously don't want to reassure people when you very much can't rule things out. I think it's have to be absolutely clear. One thing I've encountered in talking to some public health professionals is a thought of, well, if I'm not asking the public to do anything, I don't necessarily have to talk to them about it. And I just think that's fundamentally false. That's just false. People expect to know. They expect to know.
Yes.
Even if you're not asking them to do anything, you can say, listen, I'm not asking you to do anything. I'm just letting you know what I know. And I'm let you know when I'm going to tell you more. But I think failing to tell people things, in that absence, people will come to conclusions, and those may not be the conclusions that you want. They might think that, well, why aren't they talking about this? Maybe they're not talking
Yeah.
about this because there's something else bigger. Maybe there's something, all sorts of rumors and lies can kind of flourish in that kind of information void. So I think it's really important to do much more communication than I think we've typically thought we've had to do.
Yeah. I want us to talk a little bit about the Ebola Bundibugyo outbreak that recently declared public health emergency of international concern. I know WHO also warned that the outbreak is outpacing response efforts, but what does that tell us about the global response architecture to threat pathogens at this moment?
This is a very, very challenging outbreak. It's a species of Ebola virus for which we don't have the same kind of tools that we have come to rely on in more recent Ebola outbreaks. So, no vaccines, no specific treatments, limited testing abilities. That just makes it much harder. It means that you have to rely solely on public health and social measures, the non pharmaceutical interventions. Really, really hard when you're dealing with an outbreak in an insecure setting where people's concerns about earning money and getting food may collide with recommendations for how to stay home to quarantine, for instance, or even isolate. So it's really, really challenging. I think what's really stunning to me is given the potential for the outbreak of this virus to continue to spread more broadly. Again, I don't think this is going to be a global pandemic, but I do think it is an important concern for surrounding countries, and others may have some importations, given that we're not seeing the kind of robust, internationally coordinated response like we saw during the 2014 Ebola outbreak, which was the largest, deadliest Ebola outbreak on record. And instead, we're seeing, some attempt to for countries trying to keep the virus out, which, understandable instinct, but the only way that worries about the virus end is if the outbreak in DRC is contained. And that's going to require international coordination and assistance because just simply not enough resources on the ground to do the work of controlling such a multifocal outbreak in such challenging circumstances. So I'm quite worried about what's happening there.
Okay, so for a virus like Ebola, I know you've been spearheading the Global Health Security Index mission. For a virus like Ebola, where does the response break down? Do you think it's detection, isolation, community trust? Where in the chain do you think response breaks down?
So I think there is a tendency when we have these events to point to the thing that went wrong. The reality is it's everything. It's all of that. You need it all. And you referenced the Global Health Security Index, and we're actually actively putting the finishing touches on a Africa Health Security Index, which will be released in July. So stay tuned for those results. But I will say there's a reason why there are a lot of questions in those frameworks because you need a lot of things. And the absence of any of them can be what breaks the response. Usually it's the absence of multiple things. And even if you have all the tools, if you don't use them, it can be problematic. That's certainly something that we saw during COVID-19 in the United States. A lot of tools, we didn't use most of them. So there's multiple things that can go wrong. I will just say, I think the late detection of this outbreak, of the Bundibugyo outbreak, is really, really concerning. I don't think I can remember for more than 10 years another time in which an outbreak of Ebola was discovered so late in terms of the number of cases that had likely occurred. I mean, in retrospect, it probably started many months before it was detected. And some of that is because the particular species of virus is not covered by the field tests that are typically used to
Hmm.
detect or rule out or rule in an Ebola outbreak. So that's sort of an understandable technical gap, except that that's exactly what a pandemic start scenario is. Again, I don't think this is going to become a pandemic. I want to be clear. But the idea that a new or uncommon virus would start to cause an outbreak in an insecure area that perhaps is not quite as connected to common health resources and start to spread and start to grow, that's exactly how pandemics start. And so the fact that the late detection occurred, and even if we have a technical answer for it, it's not good enough because we
Yeah.
need to be able to detect these outbreaks exactly. And then when we detect them, that is the start of the effort. That's not the end, right? So a lot of effort is put on like trying to figure out when these things are happening, but much less effort thinking about, well, what do we do about them when we find them? And when you're dealing with diseases, love to exploit social vulnerabilities. They are very often propagated in populations that have the most amount of vulnerabilities and the least amount of resources. And so being able to respond to outbreaks in insecure settings, amidst violence, amidst all sorts of social challenges is exactly the work that needs to be done. And so I think from not just this outbreak, but many other ones, I think we clearly see that as a globe, we have a lot more work to do to be prepared.
Yeah. I know a lot of things has happened in the US, especially in terms of prioritization, but how should the US think about outbreaks abroad as part of its own national security?
It's not just the US. I mean, I think we have seen over and over again that countries have to recognize that disease outbreaks that start somewhere, unless contained, could very easily be elsewhere. And you don't know where exactly they're going to be. In the case of a global pandemic, some pathogens show their abilities to spread everywhere within a matter of weeks. And so there's a very limited window to act. And so, but the challenge posed by outbreaks are severalfold. First of all, there's the direct health consequences. So the people who get sick and the tolls that that takes on a society, on the ability to provide healthcare, not just for those sick people, but for everybody else who needs healthcare amidst that. Those are enormous tolls. What the absence of people from the workforce means for society, what that does to economies, what that does to social cohesion. The bad thing about diseases is they sometimes, if they're contagious, make you fear your neighbor. And what does that mean for democracy? So there are many ways that disease outbreaks can pose security threats. They harm economies, they harm social
Mhm.
cohesion, they can affect military personnel, if you want to be very literal about the security implications. So allowing diseases, outbreaks to spread and harm populations really has a multitude of effects. With COVID, the idea that someone can recover and perhaps experience long term health consequences that limit their participation in the workforce. All of this can lead to lower economic growth, greater instability, which doesn't, both of those things are not good for security.
And I think as part of the intervention from countries, to what extent do you think travel bans contribute to preventing the spread of infection? Is it an effective strategy that countries
Yeah.
should rely on?
So the best evidence we have in support of travel bans is that countries that were able to implement them early and then implement domestic measures. And we're not talking about an Ebola here. We're talking about mostly a more contagious disease that spreads more easily. But, maybe you could extend it to Ebola a little bit. It's just not the most contagious disease we know. Let's take COVID, for example. Countries that were able to implement travel restrictions early and used whatever delay they provided to bolster their domestic response measures did see some benefits. Unfortunately, the only countries that we saw that happen in were small, generally island nations. And it raises the questions of whether
Yeah.
that means what that means for countries that are not those, that don't have very clearly marked borders and are less, are more internationally connected. In the case of Ebola, I'll say the other thing that we know about travel restrictions is that if they're going to work best when you have a clear idea where in the world the virus is and where in the world it isn't, so that if you're going to implement travel restrictions, you know which countries to single out for the travel restrictions and which ones not to. In the case of COVID, we didn't know any of that. We kind of famously in the US implemented travel restrictions from China. The US was actually quite late to implement those travel restrictions. And meanwhile, a very large outbreak got seeded in New York City via travelers from Europe, because Europe wasn't on the list, because we didn't really think that was where the threat was, because that testing hadn't turned on there, et cetera. So we don't have a great track record for travel bans in terms of their abilities to stop, or in some cases even slow, the spread of diseases. We do have a lot of evidence, though, that they can actually make it harder to do what ultimately does stop the spread of diseases, which is containing the outbreak. And right now, the biggest concern for DRC is that we contain that outbreak there. We stop the spread where it's happening. And if travel restrictions make it harder to get goods and people, supplies to DRC in order to stop the outbreak spread, then the bans are actually going to do something worse, which is make the spread of that virus greater.
I know a lot's happening, but what do you expect to happen in the next coming weeks with respect to the response to the Ebola outbreak? And what are some of your expectations in terms of how this
Yeah.
outbreak goes?
I'm not sure fully what to expect, because I do feel that we don't have a full sense of what is happening on the ground in DRC. I think there are some encouraging signs. They've been able to reduce the number of suspected cases by through some testing, realizing that some people who were originally thought to have Ebola may have had something else. And so that's
Mhm.
encouraging. I know Uganda in particular, but also now DRC is improving their ability to do contact tracing. My concern is that in DRC, that may be in some areas of where the outbreak is spreading than others, and it really needs to be everywhere. Someone today on a different call asked me, like, what are you looking for? What's going to make you start to breathe a sigh of relief regarding Ebola and Bundibugyo? And I say, the metric that I want to look at that I haven't seen is what percentage of new cases are coming from known contact lists. Because when the outbreak is close to ending, that number will be close to 100%, meaning we don't think there's any community spread. The only cases we're seeing are in identified contacts of previous cases that are already at home quarantining and therefore now are not likely to spread the disease further. Just knowing that contacts have been reached doesn't tell me what we need to know, which is, are they at home quarantining, and how many other cases are occurring in the community that are not linked to known cases. And so I will remain worried about DRC. I will take any good news that we can find, but I also think we shouldn't let that cloud our concerns for what could be happening, such that we don't try to get ahead of any potential problems. And I do remain quite concerned about the fact that this virus is spreading in kind of multiple geographic areas that are quite decently apart. And it's not easy necessarily to get resources or responders to all the places where the virus is spreading.
Thank you so much for your time. Before you go, we have a short segment where we ask very short questions and then you provide like very short answers. I know like some of the answers may not be exactly perfect, but at least it's helpful. So my first question is, what is the most underestimated emerging infection threat that people don't talk about?
Measles. Measles is such a proxy for how strong our systems are. In a system that is strong, you will not have measles. And the fact that we have measles outbreaks tells me almost everything I need to know about how unready we are. Because controlling measles exercises every single piece of the response. Sorry, that was not short, but measles.
Okay. The weakest link in pandemic preparedness is
Communication,
communication. Agree. The most important lesson from COVID-19 that we keep ignoring.
community engagement,
The one public health investment we must protect.
trust.
The biggest mistake governments make early in outbreaks.
Overconfidence.
One thing that gives you hope about the future of pandemic preparedness.
We have made important gains. I want to say more, but I'm trying to be short. But I think there's a lot more to say on the optimism side. Also, young people. I'm working on the Africa Health Security Index and getting to collaborate with partners on the continent, researchers, academics. We have an amazing reference group. The talent, the abilities, the passion, the dedication on the continent is extraordinary. That is the place that's going to lead. That is where innovation is happening. There are challenges for sure. I'm worried about the outbreak now, but boy, I have never seen a group of the talent that is amassing to be able to combat it. So that gives me enormous encouragement.
Yeah, good to know. Before you go, any final words to listeners, especially people worried about the ongoing emerging infections and what they need to do to stay safe?
So I just maybe make a shameless plug, which is that we publish a weekly tracking report where we try to do that. We try to keep tabs on the diseases and outbreaks that are happening. The bigger ones, the ones that tend to spread internationally. So it's called the tracking report. It's free. And then we'll try to tell people what they need to know about it. And so that's my suggestion.
Yeah, I think I'm actually subscribed to that
Great.
newsletter. I know you are mostly on LinkedIn, so people can
Yeah.
follow you. You share updates on emerging infections.
Yep.
I
LinkedIn,
help.
Blue Sky, Twitter
Okay,
very
yes.
rarely. Yeah.
All right. Thank you. Thank you so much for your
Excellent. Thanks
time.
so
I
much.
truly
Take
appreciate it.
care.
Yeah. For more thoughtful conversations on health, science, academia, career, and public life, follow the Scholars Table with Dr. Banda. Watch or listen on YouTube, Apple Podcasts, and Spotify. The conversation continues at the Scholars Table.